Now, the humanitarian situation in Gaza continues to be critical, and it is exacerbated by challenges in delivering aid due to ongoing conflict and restrictions. Today is the last day for 37 NGOs to leave the Occupied Palestinian Territory. Despite the challenges, several organizations are working to provide aid. I'm joined now by Claire Nicolet, Doctors Without Borders Emergency Coordinator for Gaza. They are one of organizations ordered by Israel to halt operations in Gaza and the West Bank. Nicolet, thank you so much for your time. While we're focusing on what's happening in Iran, the situation in Gaza has, of course, not become better. Talk to us about what this new development means.
Yes, indeed, the situation is not getting better, and unfortunately, we have less and less difficulties to respond to the needs because indeed we have been forced out at least by the 1st of January already. We cannot receive as MSF and other organizations supply, so it means we are already not able to continue providing at the same level, most probably in the coming months because of this lack of supply. And now we had all our international staff as well who has been forced out because of this new decision on the Israeli authority that we shouldn't be able to operate anymore.
Yeah, talk to us about what the situation is like, given that today is the deadline, but obviously there's still a need. So this obviously threatens to reduce the already suffering humanitarian aid that is already provided to the people of Gaza. But give us a picture of what the situation is like now and what it's likely to look like in the coming days.
Yeah, so indeed the situation continues to be terrible in Gaza, meaning that, of course, 80% of the Gaza Strip is already destroyed. Half of the hospitals are not functional anymore, and the ones who are functional are very poorly functional. So we are trying indeed to respond to these needs, and we are trying also to respond to the water needs, who are enormous, no? Because the conditions where the population is living are so bad. So we are trying all of our organization to continue these activities, but we are really being impeded and we have really difficulties to continue operating in these conditions. And now we will continue to operate even more difficultly because of this impossibility for us to bring more supply. We are determined to continue our activities nevertheless. And as MSF, we are supporting more than 20 health centers and hospitals, and we are really willing to do so. But how we can do that without any supply, without no more international staff bearing witness as well. So this is all what is at stake at the moment in the Gaza Strip with this decision.
Yeah, talk to us about the dangers of continuing despite this deadline that says you must be out by the 1st of March.
Yeah, so far we will continue activities, but of course we are not so sure how we can do that because already it will be only our Palestinian colleagues are continuing these activities, which of course is the most important part of our staff, meaning there are 90% of the staff are indeed our Palestinian colleagues. They will continue, but of course they have been under attack for all these 2 years. MSF only, they had 15, we had 15 people have been killed over this war. So they are working under extreme conditions, no? And we don't know how the security will continue. And now, of course, there is, on top of this regional war, I can say, at the moment. So this will be more and more difficult not to be able to treat all these patients. And just remember, we have more than 170,000 people who have been injured during this period. Most of them, they need to have long-term health care. So how this will unfold, it's really difficult to know. But the reality is that we will have the possibility to give less aid when we need much more, and the situation remains dramatic on the ground.
You are saying that the government must ensure that Israel, sticks to the decisions of the International Court of Justice. Do you think that at this particular point there has been any movement in support of those particular decisions that have been made by the International Court of Justice?
Well, what is really difficult at the moment is that we see that for more than 2 years, indeed, we have been impeded, no, for working inside and inside the Gaza Strip, meaning that we have so much difficulties all the time to bring supply in, to bring food in. Over the last period of time, we have seen people being able to even give less ration to the population because of all this impediment we have been going through. There are many drugs we cannot even import, we cannot bring them. So we have just seen over this more than 2 years now that it has been very difficult for the humanitarian aid to work, and it has been weaponized completely, this aid, and this is indeed not acceptable. We don't see any improvement on that, and of course the health system has been completely under threat and destroyed, I can say.
Nicolet, Claire Nicolet there talking to us about, the Israeli orders to halt all operations in Gaza. This, of course, despite the need for the people of Gaza, the humanitarian aid that is needed, as well as the health supplies that the people of Gaza still needs.